introduction about the technology, which is the Catalys femtosecond laser system. This is a femtosecond laser, is a very fast laser, which is USP is you just plan your regular surgeries and proceed with your regular surgeries. But in this technology, you can plan it a day before or at the day of the surgery. You just have to engage with the patient, and every time the machine is going to scan the eye during the surgery, and then you get live feedback of the images, and then you go ahead with the treatment. Many steps of the cataract surgery which were traditionally performed with your hands or handheld tools are now perfected with the precision of the laser. This technology was there since so many years, 3-4 years. It was introduced in India too. But then the newer interfaces like the liquid optic interface, which is a first time introduction in Andhra Pradesh and Telangana. So here in this type, you don't have the machine directly getting attached or fixing onto the eye. There is always a liquid which is poured onto the eye, and that liquid interface is there between the patient's eye and the machine. That means it is just a gentle and a very soft attachment of the patient's eye onto the machine, which is first one, and this increases the precision of the cataract surgery as well. So the basic thing is like the machine scans the entire eye like a fingerprint which is unique to every eye of every patient, and then that gives you and presents you a 3-dimensional scan of the entire eye, which is a live image, and then we go ahead with the surgery as such. So the unique features of this machine is, and this technology is, the capsulotomy, which is an important part of the cataract surgery, is done in 1.5 seconds. Manually it takes up to 20 to 30 seconds. And it is a high precision one. It cuts up to at an accuracy of 30 micron size, that is at the size of 1/3 the size of the human eye. There is minimal rise in the intraocular pressure, or the pressure inside the eye is minimally rise, which is only 10 millimeters. That is also very first time in AP and Telangana. And then minimal collateral damage, because it's a laser is a precise one. There is minimal damage to other parts of the patient's eye, and it gives you a faster treatment. That the entire laser procedure is done in under 2 minutes. So with this, I would like to present you a small video which gives us the introduction about the laser and the actual cataract problem as such. This is the normal eye. There is a clear lens inside the normal eye, and then the light passes through and focuses on the eye. In case of a cataract, there is a clouding of the normal lens, which becomes a little brownish with the age, and when the light passes into the eye, it goes haywire and it focuses here and there. That is the basic problem with the cataract. As you see, as the cataract progresses in the simulation, the vision goes blurred and blurred and blurred, and finally that becomes still more blurry. So in order, what we do is to restore, we do a cataract surgery, that is to remove the natural clouded lens and then introduce an artificial lens. This is the basics of cataract surgery. We introduce an artificial lens, and then artificial lens restores the vision. So what this new technology or this new machine is going to do is help us in the surgery which we do to remove the clouded lens, and then help us in various steps of the cataract surgery as such. So it is going to be a gentle, more accurate and highly customized procedure. That means you can choose whatever parts or whatever size of the incisions or openings you want to do with the patient. As presented in the video, it's an advanced 3-dimensional construction of the entire parts of the eye where we are going to operate is done and scanned by the machine, and that part is presented to the surgeon, who then performs the various steps of the surgery. In the traditional surgery which is presented, a manual blade is used to open the part of the eye, and then various other 2 incisions are also done to access the different parts of the eye. Then a surgical instrument is used to make an opening in the natural lens of the eye. But in a laser procedure, the entire opening is done with an automated laser. The laser fires the initial incisions at the precise location and the precise size. We are still talking in sub-millimeter accuracy. So when the laser makes the incisions, they are accurate up to the millimeter in terms of the cornea incision, and the main lens incisions are made at sub-micron level accuracy. So on the left you see the manual opened lens part, and on the right you are seeing the machine opened lens part. Then after opening the lens, then the machine does multiple small fragments of the lens particles, which are then sucked out with the machine. The laser fragments or makes it into smaller 300 micron cubes, and these cubes are sucked out of the eye. Usually in the manual procedure, you have to go with a mechanized ultrasound machine, and you have to pulverize that nucleus or the human lens and then suck out. That which has been shown in the left side of the video. The mechanized probe uses to break it into smaller and smaller bits, but the laser has already made it into small 300 micron cubes. So you suck out with the tube. So the basic idea is to reduce the energy which the mechanized probe uses inside the eye. So what we are routinely seeing is up to 50% reduction in the mechanical energy which we deliver inside the eye. So that means there are different parts inside the eye which are non-repairable at that particular age. So when we go use this technology and reduce the energy which is consumed inside the eye by 50%, then we are reducing the damage which we are going to do the natural structures of the eye, and thereby increase the longevity of the natural eye which the patient has. So the basic thing is you reduce the energy by this technology and you increase the precision. Small presentation to sum up everything. As I've told you before, as we age, the lens becomes cloudy, and this is called cataract. When light passes through the cataract, it becomes distorted, and in the simulation, there is the distorted image, and there is the clear image. So in the conventional surgery, what we regularly used to do is you introduce a probe inside the eye, pulverize the lens with the mechanical probe, and then suck out the natural lens with that. This we were doing with advanced technology devices, but they were all mechanical. Now we have the robotic Catalys laser system, which we use to do all the important parts of the procedure, that is the opening of the eye, the opening of the lens, and the cutting of the natural lens into smaller and smaller bits, that is into 300 micron cubes. So after you doing the cubes, then you go ahead with the regular procedure like implanting various types of lenses depending on the patient's comfort and need, and then you go ahead and finish off your surgery. That is the basis of this new technology.